Welcome to Dr. Ahmed Abdelsalam Obesity Clinic. What is gastric bypass? Gastric bypass is basically when you convert the food from the normal pathway through the stomach and intestine to creating a small pouch of the stomach, which is 50 milliliters in the classic bypass or Roux-en-Y gastric bypass, and it is about 100 to 150 in one anastomosis gastric bypass, or what's so called mini gastric bypass. The second step is when we exclude 2 meters of the intestine. The whole bowel length, or the whole length of the intestine, is about 6 meters. We exclude like 2 meters, which is 1/3 of the intestine, and then we connect that directly to the gastric pouch. So we have a very small gastric pouch. You'll be eating too little, and we have excluded 1/3 of the intestine, so the absorption will be affected. So we eat little and the absorption is little, so this is how we lose weight. The privilege of the bypass over the sleeve is long-term weight loss, because the food is bit little and the absorption is affected. So the chance of gaining weight after gastric bypass is like less than 10% after 5 years, which reaches about 30% in sleeve gastrectomy. There are some drawbacks in the gastric bypass. Basically, when you eat fat, it will not be absorbed, so there will be diarrhea and gases. And if you eat something sweety or simple sugars like chocolate or whatever, it gets absorbed rapidly, and the body responds by increasing the insulin. So there will be drop in the blood glucose or hypoglycemia. So you will have normal blood glucose, then elevated blood glucose, then hypoglycemia. And this will lead to what's so-called dumping syndrome, hypoglycemia. It lasts for 5-10 minutes and then it improves gradually. You can avoid that by avoiding eating simple sugars on empty stomach. Bypass will allow you to eat more than sleeve gastrectomy and ingest water easily. Who are the candidates for the gastric bypass? Basically like sleeve gastrectomy, which is BMI 30 with medical conditions, especially diabetes, because bypass somehow is curative to diabetes, and 35 without any associated medical conditions. You have to be on vitamins lifelong if you're gonna do a gastric bypass, because there is somehow malabsorption. You will lose like 70 to 90% of the excess weight along 1 year or 1.5 years. But the follow-up should be lifelong. You should be following up with our nutrition team lifelong. For more information, please do not hesitate to arrange your consultation online through Zoom meeting or WhatsApp calls. Thank you.